By its current definition, the black market of hair transplant clinics consists of clinics that are primarily run by technicians. But I think that the definition should be broader than that. Let me explain. In an ideal setting, you have a well-trained, experienced hair transplant surgeon at the helm, aided by capable assistants, also known as technicians, working in tandem with the surgeon. This is to ensure patient safety and to generate consistent, aesthetically pleasing results for patients. And my estimate is that at least 95% of hair transplant clinics around the world are doing less than this ideal. Most hair transplants are currently being performed in other ways. You may have an experienced hair transplant surgeon who's just uninvolved with the surgery itself. For example, they might only do the markings and then disappear for the day, and that's just not sufficient involvement. Then you have doctors with limited or no experience in hair transplants that are just around, and the technicians are still doing the entire procedure. Just because a doctor is physically present, in my opinion, doesn't make it not a black market procedure. And then of course you have some hair transplants that are performed by technicians only. And this of course is the most dangerous scenario for patients. Let's talk about some of the risks associated with these black market hair transplants. The first is the potential for improper use of local anesthesia. There's a lot of local anesthesia that's used during a hair transplant. Hair transplants take a long time. And so if you're not able to keep patients comfortable during a procedure, that can be a big problem for just the way that they experience the actual transplant. It can also be a problem as far as how much bleeding they have during surgery, because remember, it's not just the lidocaine that's making the person numb, but it's also the fact that there's epinephrine within that lidocaine, and that's helping to clamp down on blood vessels so that there's less blood loss during surgery. And also there's the potential of lidocaine toxicity if too much of it is used. So you need to make sure that your clinical team has enough understanding of how these medications work and which signs to look for if toxicity is actually at play. And I have a video that I made in the past about the risks and potential complications of hair transplant surgery, and we go over this lidocaine toxicity problem in great detail. So make sure to check out that video. The next main risk of black market hair transplant surgery is the lack of sterilization. Now, oftentimes when hair transplants are not performed in the right clinical setting by people who don't know how to use, like say an autoclave, which is a sterilization device to properly process different medical surgical equipment, then as a patient you open yourself up to the potential risk of bloodborne pathogens. And you may not know that you contracted something right away, but later on you might find out that you unfortunately have some bloodborne disease that now stems from this hair transplant that you had for cosmetic reasons years ago. So that is very dangerous, and in places that are doing things correctly, there's the proper use of sterilization equipment and autoclaves, and all the pouches are labeled and there's spore testing performed to make sure that the autoclaves are working properly. All these things are important and they matter for ensuring the safety of patients. Another main risk of black market hair transplants is the high potential for poor aesthetic outcomes. Good outcomes come from first selecting the right patients, discussing medical therapy at length before surgery, and then of course designing things properly and also having the right techniques during surgery to produce the best possible outcome. And also post-operative care. That is often missing if it's just technician based and not a surgeon who's in charge of the clinical team that's following up with you, making sure that you're healing well in the post-op course. Of course, with any surgery, there's always the potential that something unusual happens, something surprising, something that's not exactly to the patient's liking, and you might need to add more grafts or make some adjustments. But all of those things can be addressed between the surgical team and the patient, assuming that the initial procedure was performed safely and that you have a nice base to then work on. Because if you have hair, for example, that was transplanted in the wrong direction, the wrong angulation, that's very difficult to come back from, especially if someone's received thousands and thousands of grafts. It's very difficult to then modify that and build density on top of that. Whereas if the initial surgery was performed properly, if it's just a matter of adding density, that's not usually an issue. You can come back in, build on what you've already started. But again, it stems from doing the right surgery from the start. start. Are black market hair transplants only found in Turkey? Absolutely not. These are not country specific. There are plenty of examples that I know of in the United States where a lot of this stuff happens. There are plastic surgeons who are not specialized in hair transplants who are offering hair transplant surgery, and then oftentimes they're just inviting a team from the outside to come in and essentially perform the entire surgery. Well, that's not okay in my opinion. I also know of some doctors who are not plastic surgeons or dermatologists or hair surgeons at all, and instead they might be like, let's say, an anesthesiologist, and they're doing something completely different, let's say in the building next door, and then there's this hair transplant clinic that they supervise, and they barely even step foot into the clinic. They don't really know what's going on there day to day, but they supervise that clinic. This occurs not too far from where I'm located here, and so this is not something that's specific to any one country. This type of activity unfortunately happens all over the world. I also know of some techs in New York who fly out to other states and perform an entire hair transplant by themselves. So there's no doctor to be found. This is in clinics that they might be med spas, they might be some other type of establishment with no doctor around, and they literally show up and are asked by the people in charge there to do the entire procedure alone. And that is also extremely scary. It's not great for these techs to be doing that for their own, I think, medical legal reasons, but it's also really a problem for the patients who are receiving that type of procedure from someone who they'll really never meet again. And when they follow up with that establishment, what is that establishment supposed to say? They're hiring someone just for that day, just for that procedure to get paid, but then they really are not doing justice by the patient. I've also met a technician here once in New York City who was bragging about how she performed a hair transplant on her uncle in some living room of her house in New Jersey. And she bragged about it as if to say like, hey, I can do this on my own anywhere. And that is a really scary thing. So you don't have to go far to see that some of this concerning activity occurs everywhere. So I think we should adjust the definition of what a black market hair transplant is. Often we say that it's black market because only techs are involved. But I would argue that it's still black market if a doctor is on record without participating in a meaningful way. I think doctors ought to do more than just mark up the hairline. They need to be involved in at least site making, which is what sets the entire blueprint for the ultimate outcome. It's not enough to have a doctor in the room or the facility, and doctors need to get the proper training. Taking a weekend course is not sufficient to be able to oversee a hair transplant properly. Usually it requires an apprenticeship or a fellowship to truly understand the art and the science of hair transplant surgery, and the problem is that these are hard to come by. Now, as we try to elevate the importance of having a great surgeon in charge of your hair transplant procedure, we have to remember that we shouldn't diminish the value of outstanding technicians and assistants during hair transplant surgery. They play a pivotal role in the ultimate outcome of your procedure. A hair transplant surgeon cannot operate by him or herself the entire day of surgery. There's always going to be some assistance involved. Now, that assistance might come in the form of help on the patient's scalp itself, for example with implanting grafts, or that assistance can come on the back table where the techs are actually placing your grafts into, say, implanter pens for proper implantation by the surgeon. And assistants are not created equally either. Some of them have more of an artistic vision, for example, than others. Some have more technical ability than others. So just like any other provider, you're going to find a range of capabilities in technicians and assistants as well. And I'll often have a nurse or a PA on my team to assist. These are people who are not just technicians, they have advanced degrees and they're highly skilled in hair transplant surgery. And one of my techs, for example, happens to be a surgeon from a different country. So you have to keep in mind that all types of people enter into the hair transplant industry. They're not all the same. It's not like you have doctors and everybody else. There's lots of different types of skill sets that exist out there and different types of people with different degrees that are doing hair transplant surgery. But the leader of the team needs to be the hair transplant surgeon with the right credentials, the right licensure, and the right experience to be able to lead a team to perform the best possible hair transplant surgeries. And I would argue that the better hair transplant surgeons assemble the best possible teams to assist them. So how do we fix the black market problem? Well, we have to raise awareness for patients to know what type of things are out there. And through videos such as this and many other resources from organizations like the ISHRS, we're able to reach lots of people to notify them of some of the activity that exists that may not be ideal for them. And we want people to take this seriously and for patients to protect themselves so that they can be as safe as possible in getting these procedures. I also think that we need to improve the education for doctors when it comes to hair transplant surgery specifically, and to just grow the excitement for the field. I think that hair transplant surgery is a remarkable specialty, and I think it's one that not enough great doctors and surgeons know about. I think if they knew about it more and all the nuances of it and how there's a technical art to it, but there's also an artistic ability that you have to have, I think more people would go into the field. So the more we can educate doctors and make them aware of this field, I think it's going to be better for the industry as a whole. And we also need to inform regulatory bodies that this type of activity is happening, because most of this black market stuff is actually illegal, so they should care. And it's happening in our backyards. You don't have to travel too far, as we talked about previously, to see some of this black market activity. Oftentimes, regulatory bodies are too reactive. They wait for something bad to happen and then they come in and give a fine or take someone's license away. But I think that they should be more proactive in the types of establishments that they allow to do some of this work. And there should be more checks into different types of clinics, into different types of establishments to see if they're performing these types of procedures, if in fact they don't have someone with the proper credentialing, or if the person who has the credentialing is not actually involved with the surgeries at all. All of this should be properly checked, and we should have a more active process to monitoring this type of action and not just reacting to problems that occur after the fact. But one of the main hurdles to improving the black market for hair transplants is, of course, price. Patients are often lured in by these cheaper prices that they see advertised, especially on, like, say, Instagram. And often many of these clinics are going to be staffed just by technicians, and that's the way that the clinic is able to keep the price down. I think that patients are putting too much focus on price per graft rather than worrying about their own safety and also the aesthetic results that they're hoping to get. I think we need to move away from this attention on price per graft and focus more on what can be achieved to create a beautiful aesthetic outcome, and one that you'll have for the rest of your life. This is a major endeavor, and I think it's underappreciated. And often I hear patients and people online and other doctors just focus so much on just price per graft. Are we going to beat this price? Are we going to be able to lower it? I would hope that over time we start to focus more on what the procedure can really do for the person as far as remarkably change how they look and feel about themselves, rather than just this kind of price per graft comparison. But let's compare actual aesthetic outcomes from clinics, not just how much are they charging. And of course, if you have a well-trained hair surgeon that's responsible for your procedure, that procedure is going to cost more than one that's performed just by technicians. And I'm surprised sometimes by how often people are willing to gamble on their health, on their cosmetic appearance, instead of saving up a little bit and going with an established place that knows what they're doing and is going to actually be able to help you in a way that's safe and effective. I think people should prioritize safety and artistic results over trying to find a bargain. Another major hurdle is trying to find these talented and interested surgeons to go into the hair transplant industry. Many of the people who have the right background, like an artistic type of background, who might be dermatologists or plastic surgeons or facial plastic surgeons like myself, we have other options. There's lots of other things we can do to make money. And those of us who truly have a passion for hair end up going into hair. But for a lot of other other people who might be excellent hair transplant surgeons, they make more money doing other procedures that they were trained in, and they don't need to do hair surgery. So they might be making a lot more money doing other things. So that's one of the challenges in trying to attract well-trained, highly skilled surgeons to do hair. And so instead, you sometimes have surgeons or doctors who maybe don't have the right background, don't have the right understanding or ability, who go into hair transplant surgery because they see a way to not deal with insurance companies, to potentially free themselves of the hospital. And sometimes that leads to people joining the field who aren't quite as skilled as some of the other folks. So it would be nice eventually to have more formal training programs for doctors and surgeons who are truly interested in investing themselves in understanding hair transplant surgery better and to improving their skills and being wonderful doctors that people can trust and get beautiful results from. But one of the other hurdles is that it's very difficult to get a hair transplant practice off the ground. It's hard to find highly skilled technicians and assistants. It's difficult to these days have a solo practice, especially in a place where, you need to have it in a place where there's enough interest in hair transplant surgery. And wherever there's enough interest, there's going to be these like large, giants like Bosley or Maxim that are trying to out-compete you with marketing, and they have lower prices. And then once you start doing hair transplant surgery, it takes, at least a year to see the result of your work. And then you might need to modify your technique. And then so it takes time to build up a portfolio. So for all those reasons, it's very difficult to get into the field and to truly make a name for yourself. And so that's another limiting factor for getting great surgeons to join the field. But I think that the more great surgeons we get into the field and the more they start to talk about their work and show their passion for the work, the more I think we'll block out some of that black market activity that's going on in the hair transplant industry. In conclusion, hair transplant surgery is an extremely rewarding endeavor. People who want to be on the provider side should get the appropriate level of training that will allow them to do whatever role that they're interested in. So if you want to be the hair transplant surgeon, go through medical school, training, residency, fellowship, all of that, get the right credentials to do that work. If you want to be a technician, well, get your MA degree and do the proper training and education and get the experience to be a great technician. If you want to be a PA or a nurse involved in hair transplants, again, get your degrees and do the right stuff and make sure you maintain your licensure. That is what's needed. And patients should be more critical about where they go for a hair transplant. And that goes for anywhere in the world. So whether you're traveling to the US, the UK, Canada, Turkey, India, it doesn't matter, but find someone good. Find a surgeon that you feel you can trust. Don't just go with the name of a clinic where you don't know who you'll meet when you show up. Make sure you know who's your surgeon, what type of team do they have, what type of involvement do they have in your procedure. Know your surgeon's pedigree and make sure that you talk to them thoroughly before the day of your surgery. Some of my favorite surgeons can be found in the beauty expert section of the Feel Confident website. So make sure to check that out. There are definitely more exceptional surgeons than just the people that you find on that list, but I think it's a good starting point, and I know that our list will only grow with time. Don't forget to stay safe on your journey to feel confident.